See the Line's an exciting event coming to London. It's a two-day event that's really going to profile the needs of research and education around concussion. First day will be an information session with medical experts, athletes who have sustained concussions, and people involved in sport and return to sport. The second day is a fundraising golf event that we're looking to raise dollars that will be attributed towards the research and education program here in London.
Concussions can happen from many different areas. At the Fowler Kennedy Clinic we see sport concussions, so sport related to contact sport generally. They can happen from a direct blow to the head, but they can also happen from a blow to the body with impulsive forces transmitted to the head. And that's an area that a lot of people don't think about when somebody gets hit. Well, some of the symptoms of concussion are really multivariable. And when we ask somebody how they feel, generally a person will say they feel pretty good. So it is important when you're looking at diagnosing a concussion to have a list of symptoms and have the patient subjectively rate a whole multitude of symptoms. And the symptoms can be somatic, relating to headache, nausea, dizziness, but they can be cognitive with difficulty concentrating, remembering, and they can be psychological with emotional issues, irritability, sleep disturbance. So the symptoms are pretty vast and varied, and it's important to understand concussion to make the diagnosis. In the future, we hope to have a lot more information about concussion. First of all, diagnosis. Right now, diagnosis is made on clinical symptoms and mechanism of injury, and there's no hard objective measure. So in the future, we're hoping to identify some type of objective measure that can make it a clear-cut diagnosis. That could include biomarkers, special types of imaging, balance assessments, and there's a lot of interest in many areas.
Donors are key to making this program work. We need donors to help us support the actual physical space to engage in the concussion research, and in the equipment and specialized tools for measuring brain performance and functional performance, and as well to support the personnel that will be collecting data from our patients. The end goal of our research is to come up with really a program where the evidence drives treatment, where we understand the risk factors for re-injury, we understand when an athlete is recovered, and hopefully some predictors for recurrence or injury in the future. Concussion research is essential. The problem is an epidemic really in sport now, with up to 10% of athletes have a concussion. So we do need excellent data and research to guide our clinical decision making.